Well, I want to get into this lightning round. Boyce and I had an idea to do a lightning round of questions, a series of questions Boyce was going to ask me. You ready to do this?
All right. So these are fun. And this is just answer as fast as you can, whatever pops in your head. Okay. All right. So here we go. Question number 1. What is your least favorite bodily fluid?
Oh, blood.
Blood.
It's got to be blood.
All right.
Yeah.
What's your favorite medical term?
What is the longest word? Esophagogastroduodenoscopy.
Dang.
Yeah,
that's good.
Longest word in like the world.
You've clearly never been to Germany. Next up.
Probably gotta have it.
What's your favorite role during a code?
I just started doing codes, and I've really just been doing chest compressions. So I've been getting a lot of experience with that. But right now chest compressions probably, and also like the scribe. I think that.
Okay.
I mean, yeah.
All right. What's your favorite go-to phrase for annoying patients or patient family members?
Oh, that's a good one. Oh, go-to phrase. Oh, I got to think of a situation. Oh, I'm blanking because I want it to be a lightning round.
Oh, that's okay.
Let's
All
go
right,
back
we'll
to
circle
it.
back. We'll circle back.
Let's circle back.
All right. What's your favorite holiday to work?
Black Friday.
Oh, okay.
It's considered a holiday.
It's ridiculous.
I used to use that. Mm-hmm.
So, what's the dumbest request that you've ever received from a provider? Or most annoying? I
remember there was a person who had calciphylaxis and their calcium level was like 10, and this intern ordered IV calcium. And I called him and I was like, you didn't really mean to do that, right? Like, that's...
Right,
and he was like, oh my God, no, I did not mean to do that. I'm like, yeah, I know.
That's like the Scrubs moment. Like, you sure you want me to give 1,000 milligrams of morphine? Thought I'd ask before I killed somebody.
Right. Like, what's the goal here? What's the plan here?
All right. Okay, the phone just rang. How do you answer the work phone?
Mickey, this is Maggie.
Okay. All right. That's a funny... I mean, the only reason I ask that is because they don't teach that in school, and you see people kind of flounder with it, and everybody has a different way of doing it.
Oh, yeah. Actually, and I forget, well, we don't have phones now, which I freaking love so much that I don't have a freaking work phone. Oh my God. That people will just find me where I am. I'm like old school in that way, but I mean, it just drives me nuts. But like sometimes I would come home and I would answer my phone, my personal phone, like 6 West is Maggie.
All right. What's your favorite medical TV show?
Oh, it used to be Grey's Anatomy. There was such a funny show. This woman, she was on Mad TV. She was Miss Swan from Mad TV. Do you remember that show?
Vaguely.
But it was a show about, I think it was like a nursing home or assisted living, but they got it spot on. It was like such a dry comedy, and they only went like 1 or 2 seasons, but I laughed so hard. I wish I could remember the name of that show. But I was so upset because it's obviously like not enough medical professionals were watching the show. And so it was just other people and they didn't get it. But like, to me, it was such a perfect show. I think it was on HBO. I got to I'll send you what it is.
All right. And then here's a slow ball. Oh, yeah, actually, sorry. What podcast are you listening to right now?
I was listening to a podcast on podcasts. It was called Make Noise.
There you go.
Yes.
All right. And what's the best university in Virginia?
Best university in Virginia? I mean, JMU.
Obviously.
Obviously. It has to be.
All right.
Go Dukes.
Well, since we skipped this one, I'll give you mine. My favorite go-to phrase for annoying patients, anytime somebody starts talking about stuff, I like to say, well, sir or ma'am, I can't speak to that. but this is what we're going to do now.
Oh, that's I think I put up with too much. I definitely put up with too much. And I definitely like people, I'm like being in acute care neuro, like you talk to a lot of confused, delirious people during the day. And I'll just like have, like nonchalant, ridiculous conversations with confused patients, just, and I just go too long with it. Like, because I'm afraid that if I tell them like, sir, you're confused or trying to like, then it's going to escalate something else. And it's like, let's just like keep this.
Let's just run with it.
Yeah, let's just run with it. Conversational.